Hey, hi everyone, and welcome to our September ALS learning series on, Open Enrollment with Emily Brown from the Patient Advocate Foundation. Before I formally introduce her, I just want to remind you all that you're muted and off camera. So just sit back, relax, and take everything in. This is being recorded, so if at any point you need to hop off the call or if you want to share this with somebody at a later date, it should be up on our website and our YouTube channel within the next day or two. The other just little bit of housekeeping is our chat is disabled, but if you have any questions, please feel free to submit those in the Q&A portion. We will have time at the end for Emily to answer any questions, so please use that Q&A box. All right, moving right along here. I just want to thank the Gilbert and Jacqueline Fern Foundation and Mitsubishi Tanabe Pharma America, because without their help, this learning series wouldn't be possible. If you are curious, need help making a decision on different types of ALS care or want to learn more about symptoms and care options, or maybe you're just curious about past ALS learning series that we've hosted, please feel free to visit our website at lesturnerals.org. We are also hosting a in-person or virtual, we have both options available, for our Les Turner Symposium on ALS. That'll be Monday, November 4th. Feel free to scan the QR code here, or you can visit lesturnerals.org /symposium to register and learn more about the speakers. Dr. Angela Genge will be our keynote speaker. And then if you are curious or want to join the National ALS Registry, learn more about clinical trials, learn more about their biorepository, please feel free to visit their website at cdc.gov/ALS. You don't have to fill out every ALS survey, just the ones that are pertinent to you. And now let me introduce Emily Brown. She works as the Patient Education Content and Project Manager for Patient Advocate Foundation. In this role, she develops new educational materials, including publications, educational webinars, and special projects to help prevent and address the healthcare barriers that many people can face. Previously, Emily worked as a clinical case manager at the Patient Advocate Foundation. She frequently worked on difficult cases, helping patients with insurance appeals related to access to novel and experimental treatment. She also has an extensive experience with Medicare, medical debt crisis, and long-term care issues, and possesses a breadth of knowledge of federal, state, and local assistance programs. Before joining Patient Advocate Foundation, she worked as the social services coordinator at a skilled nursing facility and as a social worker in an adult daycare setting. She has a bachelor's degree in social work from Christopher Newport University in Newport News, Virginia. And in her spare time, Emily enjoys traveling with her husband and being a mom to twin girls. Emily, thank you so much for joining us. I will kick everything over to you.
So much, Anne-Marie. I appreciate the opportunity to be here today. Anne-Marie said, my name is Emily Brown. I'm the Patient Education Content and Project Manager with Patient Advocate Foundation. I've been with PAF for 11 years, and I'm just really happy to be able to speak with you today about health insurance open enrollment because it is incredibly important for us to take time to think about what options are available to us and learn a little bit more about how this process works. We jump into the topic, I just wanted to give you a little bit of history about Patient Advocate Foundation. We started in 1996 with a volunteer staff of 2, and we served 150 patients our first year. And now, over 25 years later, we have a full-time staff of over 220 employees, and we have directly assisted over 2 million patients. Our foundation was started by Nancy Davenport Ennis and her husband Jack in honor of their dear friend and breast cancer patient Cheryl Grimmel. They were inspired by Cheryl to advocate for patients after Cheryl experienced hurdle after hurdle while trying to access treatment for her breast cancer in the 90s. And after getting halfway through treatment, only to find out that the procedure she was prescribed was not covered by her insurance, Nancy and Jack knew that they didn't want any more patients to have to go through what Cheryl experienced fighting for her life as well as her insurance company. So on the night of Cheryl's funeral, they wrote the business plan for Patient Advocate Foundation. And just a quick breakdown of our different areas of engagement and services that we provide to patients. Patient Advocate Foundation assists in a multitude of ways. Our case management services are provided at no cost to patients or their point of contact. Patients are eligible for services if they have any insurance status. They can be any age, gender, ethnicity, cultural heritage, any employment status. Patients can reside in any state in the U.S. or any U.S. territory, have any income range, including no income, and can be diagnosed or screening for a broad range of diseases and diagnoses. Last year alone, we served patients with over 1,000 different diagnoses. Our copay relief assists patients with diagnosis-specific funding to pay for copayments. Some funds also assist with medical insurance premiums. And through our financial aid funds, we administer small grants directly to patients to help cover other non-medical expenses like transportation, food, housing. That assistance is also diagnosis-based. PAF's education initiatives provide actionable advice and guidance to patients, caregivers, and healthcare professionals with a wide range of topics in a variety of different formats. We have webinars, interactive trainings, written publications, podcasts, animations, and more. We also offer a Scholarship for Survivors program that grants scholarships to patients who've been treated for life-threatening diagnoses in the last 5 years. So we have undergraduate and graduate students eligible to apply. So today we're going to discuss what open enrollment is, some basics of the health insurance marketplace, some Medicare basics, as well as special considerations when choosing a plan for those diagnosed with ALS. And first, I want to very quickly take us through a brief overview of the basics of health insurance in general. So health insurance is a type of insurance coverage that typically pays for medical, surgical, and prescription drug expenses for the person covered by the policy. Health insurance can reimburse or pay the care provider directly for medical expenses when you have an illness, injury, or health condition. And we like to say you can think of your health insurance policy like a contract. So the contract requires that your health insurer pays some or all of your healthcare costs in exchange for your monthly premium. You won't lose your policy based on the number of claims that are filed or how often you use your insurance plan. There's many types of health insurance, including public and private. Public insurance is generally sponsored by the government and funded by taxpayers. And the main types of public plans include Medicare, Medicaid, and TRICARE. Private health insurance is also often called a commercial plan. These plans are normally available through your employer or a spouse's employer, the open market, or from the health insurance marketplace. So open enrollment is the time every year where you can shop for insurance. You can buy insurance for the first time, continue with the plan that you already have, or purchase a new plan during this time. Open enrollment periods vary in length, and they can typically be as short as 2 weeks. Some are a few months long. So it's really important to just be aware of the time frame that your open enrollment is. The changes you make during open enrollment will go into effect the next plan year. Open enrollment dates don't always line up with the calendar, especially if you get insurance through like your employer or your spouse's employer. I know at Patient Advocate Foundation, ours runs February to March. So our plan year starts over really in the first quarter, while others go by calendar and some are at other times during the year. So just important to be aware of when you need to be making these changes. And the choices that you make during this time determine the next 12 months of coverage. So you really want to make sure you're being thorough and taking your time to research and look at your options, just like you would with any other big purchase. So if you were deciding you wanted to buy a new television, you're going to take time to look at your options, evaluate your choices, look at your budget. You would look at all of the TVs in the store and look online, pros and cons, weigh the features of the TV, the screen size, how it fits in your entertainment center. And really, that's the kind of thoughtful approach that you should be taking when you're purchasing insurance, because the plan selection you make is going to determine how much per month you're paying for premiums, as well as other costs like copays, coinsurance, and deductibles. Your choices can also affect what kind of care you have access to, what medical providers are available to you, what medications are covered, what treatments you might have access to. So it's really important to be thoughtful and intentional during open enrollment. So there are several different ways you can obtain health insurance coverage. So first, every state has a marketplace website for health insurance, also known as an exchange. State exchanges offer many different plan designs. They are designed to meet your budget and your healthcare needs. You can find each state's marketplace or exchange at healthcare.gov. You also have the option to seek insurance through your employer or your spouse or domestic partner's plan, if that's available to you. Most employers that provide insurance pay a portion of the premiums on your behalf, so that will likely offer the least expensive option for you if that's available. If you happen to be under 26, and your parents are willing to carry you on their plan, that's a viable option as well. If you're over 65, have been diagnosed with certain medical conditions, or have been determined to be disabled by Social Security, you may be eligible for Medicare, which is a federal insurance program. Details can be found at medicare.gov. We're going to go into detail about Medicare a little later in the presentation. Medicaid is also an option. It's a federally mandated state-run program. It is generally for low-income people, families and children, pregnant women, elderly folks, and people with disabilities. To be eligible for Medicaid, you must meet both a coverage category as well as income and asset requirements. States have agreed to expand Medicaid, meaning that they offer benefits to more people, because it is generally a more limited program. So if you're in one of the states that have expanded benefits and you previously were not eligible for Medicaid, it might be a good time to take a peek and see if you may be eligible now. And you can get more information about Medicaid at medicaid.gov. And another option you can consider is just buying directly from a private insurance company. Online sellers, you can reach out to an agent or broker. Contacting the insurers directly is the best way to pursue this option. And if you choose those options, you won't be eligible for any kind of cost savings provided by the health insurance marketplace that we'll talk about in a bit. So let's look a little deeper at health insurance marketplaces. As I mentioned, the health insurance marketplace is also sometimes called the healthcare exchange. It is an online hub in every state that sells qualified health plans. So when the health insurance marketplace was being structured, states could opt to run their own exchange. So some did choose to do that. California runs its own exchange. It's called Covered California. Maryland has the Maryland Health Connection. Many other states choose to run their own, but other states opted for the federal government to run their marketplace. So you will see those plans on healthcare.gov. If you choose to go to if you go to healthcare.gov and your state has its own exchange, you will just be redirected to your state's exchange to shop for coverage. What's really nice is that the marketplace lays out your options, and it really does make it easy to compare plans one-to-one. All the insurance products offered in marketplaces will be broken into 4 categories. The plans are either going to be bronze, silver, gold, or platinum. The bronze plans will most often be the cheapest in terms of premium. They're designed to cover approximately 60% of covered medical expenses up to your out-of-pocket maximum. The silver plans cover approximately 70% of covered medical expenses. Gold covers around 80%, and platinum will cover 90% and above for covered medical expenses. So as you can see, the amount of coverage increases as you move up the tiers. However, generally so does the premium. So you are going to be paying more for additional coverage. To be eligible to purchase insurance in a state marketplace or in the federal marketplace, you must live in the U.S., you must be a U.S. citizen or be lawfully present. You cannot purchase insurance if you are incarcerated. You're unable to enroll in a marketplace plan if you have Medicare or TRICARE, and it's actually illegal for someone to try and sell you a marketplace plan if you have those types of coverage. As I mentioned a little earlier, dates and deadlines are crucial when it comes to open enrollment. So make sure you're completing any paperwork before your open enrollment period closes. For the marketplace, we're looking at November 1st to January 15th for open enrollment. December 31st is when your coverage for this year ends, if you already have coverage through the marketplace, and January 1st starts your new coverage. And as I kind of mentioned earlier, open enrollment dates for other types of insurance vary. So if you get insurance through your job or a spouse's job, those dates are dependent on your employer. And it's best to contact the Human Resources Department for more information on those dates and how that process works, just so that you're not missing an opportunity to review your coverage. To enroll in a plan through the health insurance marketplace, you need the names of all the members of your household, even if there's somebody in your household who will not be applying for coverage. You'll need the age, date of birth, and mailing address for everyone in your house, social security numbers for each person, your household income, which can be a close estimate, doesn't have to be exact. A list of current treatments and medications for everyone enrolling, as well as any preferences for providers, health facilities, or pharmacies that you may frequent. As you have several options to enroll, you can apply at healthcare.gov, on the phone with their marketplace call center. You can get in-person help and work with people in your community trained to help you apply and enroll. Healthcare.gov has a zip code search to locate a person in your community. You can go through an individual agent or broker, or you can complete a paper application downloaded off of healthcare.gov. The marketplace is the only place you're going to find financial assistance to help pay for commercial insurance. There's an offer called premium tax credits, and they're available to individuals between 100 and 400% of the federal poverty level. So depending on your income and how much of your income you will spend on healthcare coverage, you may qualify for a premium tax credit. And in addition, there's extra savings known as cost sharing assistance if you enroll in a silver level plan and have an income below 250% of the federal poverty level. So your eligibility for financial assistance is determined when you fill out your application during open enrollment, and it's based on both income as well as your household size or the size of your family. And once you complete your application, you should be informed about the amount that you would be able to receive in assistance almost immediately. And unlike other tax credits, you don't have to wait to file your taxes to receive the tax credit. It's actually provided as an advance payment at the beginning of your coverage, and it's sent directly to your insurance plan to help reduce your monthly premium. The only caveat to this is that if your income increases drastically over the year, if somebody's working a lot of overtime or gets a new job or whatever it might be, you may have to pay all or a portion of that credit back if you're approved for it. So always be sure to let the health insurance marketplace know if you have changes in your household income or the size of your household. So let's switch gears a bit and discuss Medicare. A federal health insurance program that began in 1965. It's overseen by CMS, the Centers for Medicare and Medicaid Services, which is a Department of Health and Human Services. And it insures people 65 or older, people younger than 65 that have been deemed disabled by Social Security, people with end-stage renal disease who require dialysis or transplant, and people with ALS that have been deemed disabled. Medicare is paid through 2 trust fund accounts with the U.S. Treasury that are used only for Medicare. And these funds are acquired by different sources, including employer-employee payroll taxes, income taxes on Social Security benefits, premiums paid by Medicare beneficiaries, and funds that are authorized by Congress. Medicare, and we talk about it as if it's kind of one thing. It's actually many different things. Medicare is broken up into different parts of coverage, including hospital, medical, and prescription coverage. So we will go through all those as well. As noted on the last slide, one of the factors for Medicare eligibility is disability approval. Normally, there is a 5-month waiting period to start receiving benefits once you're approved for Social Security disability. But the ALS Disability Insurance Access Act of 2019 actually eliminated that 5-month waiting period for people with ALS who are approved for benefits on or after July 23rd, 2020. So now, thanks to that legislation, once your application's approved, you can start receiving SSDI benefits with no wait. Along with that, why this is so pertinent is along with eliminating the 5-month waiting period for benefits, that legislation also eliminated the 2-year waiting period for Medicare, which generally how that works is once you're approved for Medicare, you have to wait 24 months. Once you're approved for SSDI, you have to wait 24 months for Medicare coverage to kick in. This legislation eliminated that. So once you're approved for SSDI benefits, you're automatically enrolled into Medicare for folks with ALS. So it can take a few months for patients to be approved by Medicare and receive their Medicare card in the mail, but this is just a much quicker and more efficient process now for patients diagnosed with ALS than previous. So really glad that this legislation is now able to help so many folks. Many ways you can actually get Medicare coverage, but the 2 main types we're going to talk about today are Original Medicare and Medicare Advantage plans. So Original Medicare includes Parts A and B, and it's set up so you receive your benefits right from the government. So Part A includes inpatient hospitals, skilled nursing home care, hospice, and some home health care services. Part B covers outpatient expenses like doctor visits, lab tests, home health care services, durable medical equipment, and some hospital outpatient care. There are no networks for Original Medicare. So you can go to any healthcare provider that accepts Medicare and be able to access care there. Part D drug plans. These benefits are offered by private insurance companies, and these insurance companies must provide minimum benefits required by Medicare. They don't all have to cover the exact same prescriptions, and they won't. However, there is a minimum level of coverage that any Part D plan has to offer to its members. Medicare Advantage plans, sometimes referred to as Part C, offer benefits through private insurance companies, and they bundle Medicare coverage. So these plans have to cover as much as what Original Medicare covers. So the government sets the rules and guidelines, and then private insurance companies sell and administer these plans. A lot of them also decide to include Part D coverage within their benefits. And to be eligible to enroll in Medicare Advantage, you have to first be enrolled in Medicare Part A and B, and you have to live within the service area of the plan. Medicare is individual insurance, so any spouses or dependents cannot be on the same Medicare plan together. Like generally with commercial coverage, you can have, spouse or dependents, your kids all on one plan together. That's not how Medicare works. So if more than one person in a family is eligible for Medicare, each person's responsible for their own premiums, deductibles, co-payments. That's true for both Medicare, Original Medicare, as well as Medicare Advantage, as well as Part D plans. And there's no kind of discounts or anything like that for married couples. Medicare supplemental insurance, also known as Medigap, helps to cover the remaining healthcare costs after you have Original Medicare. They pay, such as co-payments, co-insurance, deductibles. To enroll in Medigap, you have to have Part A and B. Medigap plans are different from Medicare Advantage plans. They are both sold by private insurance companies. However, they are vastly different in their purpose. Your monthly premium for a Medigap policy is going to vary depending on which policy you choose. Some Medigap plans also cover services that Original Medicare doesn't cover, like if you travel outside the U.S. and need healthcare coverage, or need healthcare services, then sometimes Medigap policies will have that type of coverage for you, and then various and sundry other services. When you have a Medigap plan, Medicare typically pays its share of the Medicare approved amount for any kind of healthcare services you're receiving. And then your Medigap insurance company pays its share based on which plan you've purchased. Buying a Medigap policy is voluntary. You're responsible for paying the premium, which is in addition to the monthly Part B premium that you pay to Medicare. And as long as you keep paying your Medigap policy in your Part B premium, you can continue to keep your policy even if you have health problems or you have a new diagnosis or something like that. There are limits to when you can purchase these plans, as they are subject to exclusions for pre-existing conditions. It is best to sign up when you are first eligible for Medicare, because if you wait, the plans do not have to cover you. People who are under 65 and enrolled in Medicare due to ALS might not have access, depending on where you live. So 33 states in the US have at least some type of guaranteed issue requirements for Medigap when a disabled Medicare beneficiary is under 65, although insurers may still be able to charge higher premiums for enrollees under 65. And in most of the remaining states, at least some insurers will voluntarily offer Medigap coverage to folks under 65. Chart provides just a good visual of the different parts of Medicare and kind of what's covered under each. You're going to have access to these slides, so I'm not going to spend a lot of time on this one, but it is good for just a quick reference to kind of see what each part covers and kind of how all the parts and coverage parts work together. Medicare prescription drug coverage, known as Part D, is undergoing some major changes. Very good, exciting changes, but it's something that I just wanted to take a little bit of time to discuss. With the updated benefit design, you will not have to deal with multiple coverage phases like you typically had to. You may have heard of the donut hole or catastrophic coverage. This is kind of coming to an end. The Inflation Reduction Act made some big changes for prescription coverage for Medicare. So now the way that it's structured is you're going to pay for your prescriptions after paying your deductible until you reach an annual out-of-pocket limit of $2,000, which is great because previously there was really no limit to how much you would pay. In addition, there's a new Medicare prescription payment plan that could change how you pay for your medications. So I'm going to go into a little bit more detail about that program. The Medicare prescription payment plan allows people with Medicare prescription coverage to pay out-of-pocket prescription drug costs in monthly installments instead of all at once. So you're not automatically enrolled in this program. You have to choose to opt in. It's free. Anyone with Part D can opt into the program at any time during the year. And it applies to any Medicare Part D or Medicare Advantage plan that offers Part D benefits. If you opt into the program, you will not pay for medications at the pharmacy when you pick up your prescriptions. Instead, your Part D plan pays the pharmacy, and your plan will send you a bill for the amount that you owe for the remaining months of the year. So this is referred to as smoothing. And really, it's just a great way to spread your out-of-pocket medication costs out throughout the year, paying part of those costs each month up to the maximum amount of $2,000 in total. So instead of having this huge lump sum at the beginning of the year and your medications being really, just really costly right out of the gate, now you're able to spread those costs out over the course of the year. So the program does not lower your out-of-pocket costs. I want to be clear about that. It does not change the amount of money that you pay for your prescriptions. However, it does make paying for your prescriptions more manageable by just spreading out the cost throughout the year instead of just having this huge lump sum you have to pay all at once. So during the 2025 open enrollment period, individuals with Part D or Medicare Advantage plan that covers prescriptions are eligible to enroll in the Medicare prescription payment plan. You just have to contact your Part D plan provider or your Medicare Advantage plan and follow the enrollment process. Since this is brand new, they're still kind of working through everything, but I've seen that it's a fairly quick process. You or an authorized representative for you can submit an election request to join the program, and you can actually do that on paper, by phone, or online. And then your Part D plan or your Medicare Advantage plan is supposed to be able to process that enrollment within 24 hours. All Medicare Part D drugs are included in the program. So there are no exclusions that any Part D plans can make. So they can't exclude any expensive medications, specialty medications, anything like that. Once you opt into the Medicare prescription payment plan, all of your out-of-pocket prescription drug costs will be billed monthly, as long as you want to remain in the plan. I wanted to just go through quickly why it might be good for some folks and why it might not be good for some folks to opt into the Medicare prescription payment plan. This program is really going to be best for folks who have high prescription medication costs that cause them to hit that $2,000 out-of-pocket cap earlier in the year. Those are the people that are going to benefit most from this program. If you have assistance from a charitable foundation, like a copayment assistance organization or something of that sort to help you pay for your medication, you may not benefit as much from this program. Or if you are enrolled in low income subsidy or extra help, it is likely to not benefit you as well, as your medication costs are already going to be very low. It's really just important to figure out what's best for you based on your annual medication costs and any help that you get from any third-party organizations like a copayment assistance program before you decide whether it's going to be a good fit for you. And actually, Medicare just released some information to kind of help you determine if you might be a good candidate for the program. And the link here on the screen offers some really good information. There's an educational informational video that Medicare's put out that kind of walks through the program step by step and kind of helps you understand more the big changes to Part D that are now taking place. So I encourage you, if you're interested, to either reach out to your Part D plan if you already have Medicare, or to go to medicare.gov and check out the information that they have there. Patient Advocate Foundation, we also have some information about the program that I believe is going to be shared with you. So it's a novel thing for Medicare. I think it's going to be really good for a lot of folks, and it's a big change. So I just want to highlight that change and let you do a little bit more research to decide if it might be beneficial for you. So when it comes to enrollment for Medicare, it can be kind of confusing because there are several different enrollment periods. So stick with me. We're going to roll through them one by one. So when you first become eligible for Medicare, you have a 7-month initial enrollment period to sign up for Part A or Part B. That enrollment period starts 3 months before you turn 65, and it ends 3 months after you turn 65. So 3 months before the month of your birthday, and then 3 months after. So during this initial enrollment period, you have the option to opt into Original Medicare with or without Part D, or to buy a Medicare Advantage plan. If you're under 65 and newly eligible for Medicare due to a disability, you also have a 7-month initial enrollment period where you can choose your Medicare coverage. But this enrollment period begins 3 months before the 25th month of receiving Social Security benefits, and it ends 3 months after your 25th month. As mentioned, for ALS, you're eligible for Medicare as soon as your SSDI benefits begin, and then there's no longer a waiting period. But I did just want to let you know how it typically works for folks who are not diagnosed with ALS as well. So Medicare has a yearly open enrollment period. It's normally from October 15th to December 7th annually, which is why this is a really great time to be having this conversation. We're getting ready to go into open enrollment soon for Medicare. This enrollment period allows you to make changes to your existing Medicare coverage if you're already on it. And it's really a good opportunity to review your current plan to see if there may be a better option, or if the new plan has additional features or other features that you could utilize. Any changes you make to your Medicare coverage during this enrollment period becomes effective January 1st of the following year. So during this enrollment period, you can change from Original Medicare to an Advantage plan. You can change back to Original Medicare if you're on an Advantage plan. You can change your Medicare Advantage plan to a different one. You can join or change your Part D plan, or you can drop your Medicare Part D plan altogether. I've listed some important dates there on the side, just kind of when coverage starts and ends and when we need to be aware of open enrollment dates. Medicare Advantage open enrollment is between January 1st and March 31st. And during this time, really, it's only for those who are already in Medicare Advantage plans. So you can leave the one you're in and go back to original Medicare and enroll in a Part D plan if you choose. You can swap to a different Medicare Advantage plan with or without drug coverage, or if you signed up for a Medicare Advantage plan during the general enrollment period we just discussed, but then you decide, I don't really like this, you can make a switch at that time. However, only one swap is allowed during this enrollment, so you can only make one swap during this time. Enrollment period is actually fourth. The yearly general enrollment period, that's January 1st to March 31st. It's the same time frame as the Medicare Advantage enrollment, but this one is a little bit different. If you're currently enrolled in a Medicare Advantage plan or a Medicare drug plan, you can change your plan at this time, and your coverage begins the first of the month following your enrollment. The changes you can make at this time are a little bit more limited. If you are in a Medicare Advantage plan, you can switch to another one, or you can change to original Medicare and join a Medicare drug plan during this time. You are unable to switch from original Medicare to a Medicare Advantage plan or join or switch a Medicare drug plan if you're in original Medicare. Again, I know it's confusing. I know that I'm hoping that they're going to make some concerted efforts to streamline this process. It is really confusing. I've seen some legislation floating around about hopefully making this process a little bit easier to understand, but at this point, this is what we have, and there's 4 or 5 different enrollment periods for Medicare, which can make it pretty confusing. But I did just want to touch on all of them at this time. The last is a special enrollment period. There are special circumstances that allow you to enroll in a special enrollment period. To be given a special enrollment period, you have to meet certain guidelines. And if you didn't join Part A or Part B when you were initially eligible, because you had employer-based coverage, you will qualify for a special enrollment period. So I think that's a lot of times when folks use this particular enrollment period the most is transitioning off of employer-based coverage onto Medicare. You can use a special enrollment period and enroll into original Medicare anytime while you're covered under an employee-based insurance or during the period you have once your employer coverage ends. So you may be eligible for a special enrollment period for other reasons, like if you move, or lots of times they offer them if you have had like a natural disaster or something in the area that you live. You can switch to a new Medicare Advantage or prescription drug coverage at that time. Also, if you're losing your current health insurance coverage or your current plan changes its contract with Medicare, or if there's some kind of error from Medicare regarding your plan, those are some other possible circumstances that you might be eligible for a special enrollment. The time frame for a special enrollment period and the effective date of your new coverage really just varies depending on the circumstances that qualified you for your special enrollment period. If you decide not to enroll into Medicare during your initial enrollment period and you don't meet any of the conditions for special enrollment, you may accrue a late enrollment penalty. I'm not going to go too deep into these, but it's just important to enroll in coverage when you're eligible, because you could end up paying a lot more for the entirety of when you have Medicare if you don't enroll when you're first eligible. And I just hate to see people pay more than they should for coverage. So just really important to pay attention to deadlines and when you're eligible. I briefly wanted to touch on this. If you or your spouse are still employed, Medicare operates a little differently. So whether or not you need to sign up for Medicare when you turn 65 depends on a couple of different factors. It matters how you get your health insurance now and the number of employees that are employed by the company where you or your spouse work. So typically, if you have job-based coverage through yours or your spouse's current job, you don't have to sign up for Medicare while you or your spouse are still working. You can wait to sign up until you or your spouse stop working, or if for some reason you lose your health insurance coverage through your job. If you're still working and you plan to keep your employer's group health coverage, it's kind of best to reach out to the human resources department or the benefits administrator of that plan so that they can walk you through when is really the best time to enroll in Part B. Just a couple things to consider when you're looking at whether Original Medicare or Medicare Advantage is right for you. It's a really big choice, and that choice will affect kind of what care is accessible to you and what providers are accessible to you. Just some of the most kind of important things features of each. Original Medicare does not require any kind of pre-authorization or pre-approval before getting services, but most Medicare Advantage plans do require that. Most providers accept Medicare, so you'll likely not have a hard time finding a provider, where Medicare Advantage plans will have a smaller network of providers, so you may have a more difficult time finding someone who's offering, specialized care that might be needed. Original Medicare does not have an out-of-pocket maximum for medical services, so there's no cap on what you can spend for healthcare services. Medicare Advantage plans do offer that. Original Medicare offers no coverage for hearing, dental, or vision services, where Medicare Advantage plans often do include those services. That's to say every plan offers those, but a lot of Medicare Advantage plans offer additional benefits. And just a quick note, the total premiums for Original Medicare and Medicare Advantage can be similar, but if a plan's monthly premiums are low, its deductibles and copayments generally may be higher. So out-of-pocket costs can really be variable across plans. Apply for A or B, you enroll through the Social Security Administration website. It's ssa.gov. You will be enrolled into Medicare Part A and Part B unless you choose differently. And if you choose to enroll in a Part D plan, Medigap, or Medicare Advantage, those are also available options to do so on the Medicare website, so medicare.gov for those. Want to quickly go through looking at choosing a plan and some considerations to take into account. We want to think about healthcare costs as an iceberg. So what people see is the monthly premium and the tip of the iceberg, but you need to remember the total amount of your healthcare costs goes well beyond that premium. So those are the costs that are under the water that a lot of people don't remember or think about while they're shopping for coverage. A lot of times people choose plans based on the premium that they pay monthly. And as I just mentioned, sometimes the cheapest premium is ultimately going to leave you paying significantly more during the year for your care when you look at the cost of the deductible and other out-of-pocket expenses. When you sit down and look at your options, you want to make a list of the medical expenses that that are going to continue, like specialist visits, prescriptions, any kind of those things. You want to review your EOBs. Those are statements that you receive after every healthcare interaction. They explain how your insurance paid their portion. You want to really evaluate how much you paid for your healthcare over the last plan year. Look at how those relate to your current insurance, how the new, options you have available to you fit within your budget. Get all your paperwork together you need for the application, and be sure to submit the paperwork on time before the end of open enrollment. If you're eligible to receive cost sharing through the marketplace, be sure to update them with any change to your financial situation. Like I mentioned, if you have a big change in your income, you need to report that, and they may adjust costs. If you don't report it and then you file your taxes with a much higher income than you reported, like I said, you will have to pay back the cost sharing you received. Being that it is likely that people in your family have different health needs, everyone's eligible to enroll in different plans based on their needs. And if your situation changes and you lose insurance, be sure you evaluate all your options for getting insurance and see which ones are really going to be best for your family and your budget. Additional tips, it's a good idea to view plan options side by side. Don't just consider the premium like we talked about. You might find that you can pay a higher premium to have a lower deductible and lower out-of-pocket costs. When you're searching for plans, be sure you look at your preferred providers, and that's not going to just be doctors. That's going to be hospitals, pharmacies, any kind of outpatient walk-in clinics, labs, that kind of thing. You want to look at all of the places where you typically get care, and make sure that those are covered under your plan options. Make sure that your routine care that you have included, medications are covered. It's also a good idea to think about care you anticipate needing over the next 12 months and check to see how that care is covered. You can even talk to your care team and your providers. Since this is such a big decision, it's a good idea to have input from those that are helping to manage your care. Before you enroll, it's a good idea to get a list of current treatments and medications. The best place, as I mentioned, to shop for Medicare coverage is Medicare.gov. It's easy to compare and search plans there. If you already have a Medicare Advantage plan and you're looking at continuing that coverage, please review any of the information that was maybe sent to you in the mail or via email about your plan for the upcoming year, just to make sure there are not any big changes to your coverage, to your drug formulary, and any kind of prescription coverage. I would hate for that information to not be reviewed, and then for the next year you're stuck with a plan that doesn't meet your needs. So it's great to just take a peek at that, even if you plan to continue and you're happy with the coverage that you have. If you're unsure about enrollment for Medicare or you're overwhelmed with the options, there is guidance. The State Health Insurance Assistance Program provides one-on-one advice and assistance to Medicare beneficiaries, their caregivers, their families. They're all trained volunteers. They're just a great resource to help guide you in choosing a plan and just navigating Medicare in general. As if you need assistance with enrollment for the marketplace, as I mentioned earlier, you can go to localhelp.healthcare.gov, and a certified agent, broker, or assister can help you with your application and answer any questions you might have about the process. So once you've chosen your plan and you enroll, your insurance is not going to be effective until you have submitted your application as well as paid your first month's premium. So once that happens, you can expect your insurance card, other plan documentation, any kind of paperwork related to your plan in the mail. And once you've enrolled and everything is active, it's vital that you pay your monthly premiums on time so that you can keep your coverage and keep it active, so there's no lapse and you end up with huge medical bills. That's all I have today. Thank you for listening. I hope you learned a little bit about how open enrollment works. I know I kind of threw a lot at you, but it's a big, important topic. So Yeah, I think we might have time for some questions now. A couple minutes anyway.
Emily, thank you so much. Just a wealth of information. We do have a couple questions and comments. Somebody wanted to say that not all patients with ALS qualify for SSDI and Medicare, um, which is good to note. I would say if they're still working, like that kind of makes sense. I kind of understand that.
Sure.
Yeah.
So Social Security has a listing. They're called Blue Book listings. So for any diagnosis that could potentially be a disability, Social Security maintains these Blue Book listings to kind of spell out very clearly um, what the severity of the diagnosis and kind of what um, needs to be met in order for a person to be considered disabled with that diagnosis. So if you are considering applying for disability, that is a great first step in kind of determining whether or not now is the right time, is going on ssa.gov, looking for a blue book listing for ALS, and determine whether your current symptoms meet the criteria for approval. That would be my kind of tip on that.
That's a great tip. Um, Somebody else had a question. Can you apply for SSDI with ALS, but decline Medicare B coverage because you like your private health insurance?
Absolutely.
Mhm.
It is not uh, compulsory to get Medicare Part B. Like I mentioned, I would just double check with your administrator for your private health plan to make sure there's not any issues with you remaining on there when you are eligible for other coverage. And you can have both at the same time as well. So I think probably my best advice would be to reach out to your HR department or your spouse's HR department and speak to them about uh, when might be the best time to enroll for you. But absolutely, you do not have to opt into Medicare if you have other coverage.
Awesome, Emily. And then there is, okay, two more. Um, it is hard to get straightforward information on DME, so durable medical equipment coverage. It seems all commercial plans just cover one piece every 3 years. Does this sound accurate? Um, I can speak from like a wheelchair, like my background is rehabilitation, so I can talk about like wheelchairs and communication devices. It's always been my experience that insurance will only cover one piece of equipment every 5 years. But Emily, you might have a little bit more info.
No, you're exactly right. I know, especially commercial plans are all going to be different. So you really have to read your policy documents closely. And you can actually, if you're looking at purchasing different coverage than what you have, you can actually request to get the policy documents in advance and review them so you can really make the most informed choice. I probably should have mentioned that in the presentation, but that is something to consider if you're looking at shopping for different coverage. But I will say for Medicare, especially, I am familiar with the 5 year kind of plan that Anne Marie was mentioning. It's typically 5 years for uh, any kind of wheelchair or power wheelchair, that kind of thing.
Yeah. And you can also call your private insurance plan to see what their policy may be. I think that's always something when I was, so I am a speech language pathologist and used to do communication evaluations for people living with ALS. and other diagnoses. So that's always a good place to start as well. Medicare kind of sets the standard, and then typically, I will say, um, private insurance companies kind of follow suit, but not always. So, for example, in the state of Illinois, United Healthcare requires a 90-day trial of a piece of equipment, like a communication device for somebody living with ALS, before they'll cover that piece of equipment, whereas that is not required by Medicare. So just always, safe bet is always to call your plan and just ask them what their policies are for durable medical equipment. And then last question here, how can I figure out if my state requires Medicare supplement plans to offer coverage if I'm under 65, but I have ALS?
So the best place to reach out is going to be to your state health insurance commissioner. Also commissioner of insurance. There's kind of, just depending on your state, there's a different, could be a different name, but that is going to be your best place to reach out to, your state insurance commissioner. They will be able to tell you whether or not your state has any provisions for folks under 65. And if not, if there are other potential options, sometimes there's high risk pools or just other options that might be available to you. So that's likely going to be your best source of information for your specific state.
I think we have time for one more question here. I am 62 years old with ALS, and I do receive disability from SSA. When would I be able to sign up for Medicare?
You should be, well, it depends on when you were first approved. So if you already have coverage through like your spouse's policy or somebody like that, again, I think it's probably a great idea to speak to their human resources department to determine, you know, if that coverage is creditable, if they have any recommendations when it might be best for you to apply, because they really should know, like I mentioned, how many employees work there. Those are all considerations that go into determining when you should apply for Medicare Part B, especially. So that would be my advice, is to reach out to your human resources or benefit administrator for the plan you already have.
Awesome, Emily. And is it okay if anybody has any further questions or is looking for some more information, can they reach you at your email address on this slide,
Absolutely. Absolutely.
emily.brown@patientadvocate.org? That's okay?
Yes. Feel free to reach out to me. I'm happy to speak to you. As I mentioned too, we have free case management services. So if it's not something I can directly assist with, I can connect you with a case manager who can kind of help walk you through whatever situation you might be going through.
Fantastic. All right, everyone. I just want to wrap everything up. Thank you for coming today. Our next ALS learning series is going to be in October. It'll be Thursday, October 31st, again at the same time, 12 noon Central Time, with Dr. Ginny Tavi from the National Jewish Health Center. She's going to be discussing complementary and alternative therapies for people living with ALS. So be on the lookout for that registration. That should be up on our website in the next day or two, along with today's recording. Again, I just want to thank all of you for your time today, and look forward to seeing you in October. Emily, thank you so much. And everyone on this call, Have a great rest of your day. Bye now.
Thank you.